Hello, my name is Hector Diaz. Today I will be demonstrating my wound care practical. As you can see, our patient right here has suffered a wound and is bleeding. Luckily, I have all my equipment with me in one place. My vinyl gloves, ACE elastic bandage, disinfectant wipes, and for lack of a bandage, napkins. Obviously, these will not be used in the actual athletic training field, but these are just used for the demonstration. First, we're going to do to minimize contamination of the patient so we don't get blood on ourselves or infect the patient with any germs we have. We're going to make sure we put on our vinyl gloves. Put them on as such. As you can see, I am making sure I'm not touching my wrists while putting on the gloves. I make sure they slip on and are snug as such. As you can see, first step we're going to do is make sure we stop the bleeding. So I'm going to hold the bandage, the first bandage, onto the patient's arm. Wait for a bit. Check. Once it seems as the bleeding has stopped, I will then take off the cloth. After that, we are going to clean the wound. Usually a good thing to use, or the primary thing to use would be to use wet gauze with an antiseptic. Fortunately, we don't have that, so we're just going to have the baby wipe right here and clean it as if it would have been wet gauze with the antiseptic. And we're going to just dab the patient's wound clean as such. Dab a little bit more. Once the patient's wound is clean and there's no more blood coming out, that is when we're going to move on to securely covering the wound. To securely cover the wound, we're going to first put this bandage here and wrap it up with the ACE elastic bandage gauze. Unwrap this real quick. And we're gonna wrap it around a couple of times until it is securely fastened, but not to the point where it cuts off circulation of the patient. Keep wrapping it. Keep wrapping it. Bear with me. I know this isn't the most dialogue-filled practical. Once it seems securely fastened, I will ask the patient. I will see if the patient still has circulation in his fingers by using the pinky nail test. If I squeeze his pinky, by using the finger nail test, if I squeeze his nail and it turns white, can't really see. Get a close up right here. I'm gonna squeeze his finger and see it just turned white right there. That means that the patient is still receiving circulation. So once that has been confirmed, I'm going to then cut the bandage with these sterilized scissors. Like that, close it. Next step to do for me would be to safely take off my gloves without contaminating myself. I will do this by first lifting up from the wrist area right here, making sure I don't touch my actual skin. Ball it up. Have the other glove in this hand. Once that is done, with these two fingers, slip inside the glove, making sure I don't touch my skin, and wrap it closed as such. Throw it away. The next important thing to do is, if the patient still seems like he needs, as you can see, it's securely fastened. If the patient still looks like he needs further treatment, refer him to where he could get that treatment. And until he gets that treatment, educate the client in how to minimize contamination, like such as keeping the wound clean and dry, making sure not to get it wet in the shower, and such. Thank you.